Good evening, everyone. Welcome to Elets webinar. Today, we are glad to inform you that we have Mr. Sachin Rana. He is an IAS officer and currently he is holding the charge of Additional Deputy Commissioner in Chandigarh administration. Welcome, Mr. Sachin Rana. Thank you so much for your time.
Hi, good evening. Thank you so much for having me there.
Thank you. So I'll take just 1 minute to introduce you to our magazine. We are part of Elets Technomedia private. This is one of the media organization based in Noida. We are into 4 verticals: governance, education, BFSI, and healthcare. And eGov is one of our prominent magazine, which is there in the industry for the last 15 years and which covers developments in the domain of, in the sphere of e-governance, ICT, urban transformation, and anything that is related to governance and e-governance. So thank you so much for this webinar. And we are also live on Facebook, and there are people who will be listening to us on Zoom as well. So once again, thank you so much. Let's start with the current status of COVID patients in the city.
Okay, thank you everyone for joining us today in the evening. It has been a hectic day, but somehow we are able to meet you all. The status of Chandigarh COVID positive patient is very encouraging, even though it's a kind of a negative tone, but the number of patients we have in the city are much more less than anyone can think of. Total of patient as of now actively so far registered with us are 440 only, 440, out of which Chandigarh have 3 decent hospitals, sector 16 hospital, sector 32 hospital, and the Mammoth PGI. So far we have cured 349 patients successfully, and we have discharged and sent them back happily. Incidentally, we have so far have only 6 deaths. The death cases are not because of the COVID per se. They were the senior citizens and they have comorbidities. So you can kind of link that they are other symptoms, other ailments because of which they have to depart. As of now, today, when we are talking, we have around 85 positive cases in Chandigarh. And one more data is there that we have so far sampled more than 7,500 persons in Chandigarh, and depending on the positive rate, only 6% of them have turned out to be positive, which is a national ratio for the most of the lower cities. And this 6% gives us factual things also, that in Chandigarh we are able to control the spread of virus, because this data is very less. So I am very hopeful for the Chandigarh that we'll be able to control and reduce this number to a much lesser extent. Yeah.
Great to know this. So, what are the initiatives that you have been undertaking in the city to control the spread of this virus?
Most of the guidelines, as depicted by the Government of India, Ministry of Health and Family Welfare, have been deployed here in verbatim and toto with full execution promises. All the guidelines whatsoever, whether it's being the testing guideline, whether it's being the quarantine guidelines, whether it's being the screening guidelines, have been effectively and impulsively, and whatever you can say judiciously, have been deployed in the city. Most of the citizens have also followed them vigorously. People are coming out from their houses only on the need basis. When there was lockdown, so people were restricted in their houses, and people obeyed most of the time. And in very few occasions, there were skirmishes with the police and otherwise. Most of the time, people and the administration work in hand-to-hand basis, and the things were controlled.
Right. So now, since we have almost on the verge of completing Unlock 1. And,
I'll start the journey from the Janta Curfew from March 22nd. There was apprehension. The Janta Curfew was supposed to end at the 5 p.m. So people in our administration was apprehensive that people will come out in huge number and will start celebrating like the earlier day. When a small call was taken by the Honorable PM. So we imposed curfew after that time. So that was the first order under the curfew which the District Magistrate of Chandigarh deployed. And we ensured that people stayed back their homes and they reaped the benefits of the entire day when they were at home. So from that day onwards, the Chandigarh has been under the very massive lockdown. That crude term is like we can say people were forced to be inside their homes unless or until it was otherwise required. Administration supplied most of the essential items at their doorsteps, starting from milk, fruit, vegetables, medicines, masks, whatever, sanitizers. People have donated also very generously in Chandigarh. We have deployed one specific officer, Punjab Civil Service officer, who was looking after the donation part. He was coordinating with all the philanthropic organizations, NGOs, and all, and he was coordinating them. And he was a kind of a link in between the donor and people who are requisitioning those things. Then we have nodal officers for the contact tracing also. He is another PCS officer. His role is also very crucial. He is still doing, he has a team of almost 60, 70 people. They are doing a very marvelous job. They are the first responders. When somebody is tested positive or reported positive or symptomatic, they have to go at their doorstep and talk to them. It's a very scary situation in the initial days when we were not equipped with most of the things, and particularly the knowledge that how to deal with such cases. And the team was going door to door and doing that contact tracing, filling out their back routes and from where that kind of a containment has come out. Then another thing is that food distribution, because in all the cities, like in our country, we have a very marginal population also who earn on daily basis and were very in a dilemma situation what to do when the jobs were not there. So different kind of strategies were catered out. Administration also provided them a dried ration packet. A few of them were procured from the government funds. Few of them were taken on donation from the philanthropic organizations. Most of the food was cooked and served in packets to the population so that they don't have to juggle out much. More than 1.50 lakh, 1.5 lakh food packets were distributed daily to the poor people in Chandigarh who are stuck otherwise or who are working here. Similarly, donations more than I don't know 35,000 plus food packet dry rations that can run up to 15 days. One packet have been distributed in all the containment zones. We had 6 containment zone in Chandigarh. The largest one was from the locality called Bapudham colony, and it has been recently opened up. Few pockets are still to open up, but most of the pocket has been opened up. So this is the journey we have. We have extensively come out with various orders, various directions, various clarifications, various initiatives have been taken by the administration. When the curfew was imposed, curfew passes was to be delivered. So we don't want people to be worried about their movement, essential movement. Suppose they want to go to hospitals or some essential things also. So administration gave them the facility of application of online passes, curfew passes, and those passes were given within a span of few hours, even though the number was quite huge. But one of the officers took the lead and his team delivered to the hilt, and they delivered the passes. Another thing which I was mentioning you earlier, recently when this unlockdown process, which the question was also, unlockdown was opened. So people from the neighboring state or otherwise also are coming to Chandigarh for various purposes, whether it's a medical purpose or the meeting purpose or business purpose. So administration has come up with this thing, kind of a register, kind of a declaratory registration of people who are coming to Chandigarh. So there's a link on the Chandigarh government website. It's called Inbound Visitor Portal. So whosoever is willing to come Chandigarh, he is mandated to have that particular registration done. Once he is registered, a confirmatory kind of a message is sent at his mobile phone, and after which if police personnel sees that, then they'll allow facilitate their movement. Otherwise, they are forced to download that or update that information. And whosoever in Chandigarh is coming and staying more than 72 hours, that's 3 days. So he has to mandatorily undergo a quarantine, self-home quarantine of 14 days. So whosoever wants to visit must keep in mind when they are visiting Chandigarh.
Okay.
Regarding, okay.
Yeah, please go ahead.
Regarding this knowledge update or that technology use which we had done in administration, we have specifically made one website also. The IT department took the lead on that, and all the data has been updated on the real-time basis on that. And on that basis, we are also running an app on Chandigarh Go करके नाम है उनका, and that is also running. Otherwise, Chandigarh admission, that old website is still having all the orders, and they are giving also the content information.
So this is the visitor portal you're talking about that you had designed and created?
Yeah, recently, almost like 3-4 days back, we have started this portal. It's a very simple portal. All the basic details from which part of the country you are coming and what is your purpose of coming and for how many days you will be staying and where you will be staying. And in case you are willing to stay for more than 72 hours, then you are forced to self-volunteer, self-home quarantine for 14 days.
Right. Is we are, there have been relaxations across the states, right? But still, the number of people, the large number of people which are coming on the road is a matter of concern for several administrations, right? Every state wants that people should not move around without any purpose on the road. Otherwise, it can increase the chances of spreading the virus among other people. So, what are the measures taking to stop such people moving around in the city?
I would like to put it like other way around. We are not restricting people to come out. We are kind of facilitating them to come out, but we are asking them to ensure all the precautionary activities. Like they should wear mask always when they are outside. They should not clog a place. They should not be a suitable number, more than a suitable number of place that the space can occupy. Then social distancing, what we are referring this, social distancing should be monitored. They should use sanitizer and wash their hands. They should not come in close contact with the unknown persons. All these things, if people are doing, then I think administration is not restricting people's movement per se. Similarly, for that exercise which we were discussing is only for the information purpose that somebody has come and he has gone back or he has not gone back. That is the only thing.
Right. Yeah. If you can brief us about the kind of activities which are open in the city at this moment.
Except educational and otherwise some large gatherings which we already know more than 20 persons on the funeral ceremony and marriage mat, 50 persons is the limit. Otherwise all the normal activities are open, mostly activities are open.
Okay. One thing which I'd like to understand is that COVID-19 has been fatal for those patients who have some kind of diseases and the elderly people, of course. What kind of arrangements you have made for these people in different hospitals in Chandigarh city? How you are taking special care of elderly people and people with other diseases?
The kind of a administrative structure which we have come out in Chandigarh is like the entire district is divided into 3 divisions, and which is further divided, 3 divisions are further divided into the 16 incident commander wise position. Incident commander, the technical term, is the Ministry of Home Affairs explained in the Disaster Management Act. So under those 16 incident commander, they are working with SHO particular SHO concerned of that area. The facilities have been created. All the necessary information about the senior citizens, the pregnant ladies, and otherwise the comorbid patients have been taken up. In which, in the high containment area where the load of the virus is more, special centers have been created. The schools have been converted with food, some basic preparations, in which these patients, these kind of people can be screened and they can come and reside there if they have some kind of a risk. And otherwise also the entire system is in their service, at their service. Whenever such cases are reported, they are directly being taken to the highest facility possible.
Right. And what about the medical professionals who are actually on the ground and serving the COVID patients? I mean, frankly speaking, we have seen even protests from medical staff in some part of the country who probably protested for lack of equipment, lack of facilities. How you are ensuring that your medical staff is getting everything that they require to fight the disease and treat the patients?
Like I told you, we have 3 big mammoth hospital available in Chandigarh. The Director of Health Services look after the basic hospitals, and there is a college in Sector 32. and then the PGI. All of these hospitals are being provided all the necessary equipment. Like the incident you are referring to, we have never faced such an even a iota of that kind of incident. Our health workers, the lower staff, the sanitary staff, and otherwise the ward boys are being given a facility. There's a nice sarai under the Red Cross Society. We have a 300 bedded sarai. It has fully air conditioned. So all these staff are being asked after they are put on duty for 10 days, and after that they are given the rest of 10 days. That is the kind of a period for their quarantine. So they are being given that rooms where they are well fed, well taken care of. This is the staff who are normally not being taken care of or ignored most of the time. So they have been taken care of in the one of the best government facility we have in Chandigarh. And for the doctors, we have given them the facility to stay in the five-star hotels of the Chandigarh administrations. But over a period of time, they have some reluctance, and they are now staying back on their own in their own hostels. So few of the doctors are going to these hospitals, hotels, or few of them are staying in the hotels of their institutes also.
All right. How are the quarantine facilities in the city? How well equipped these facilities are, and how people who are being asked to stay in quarantine in this quarantine center, if you can brief us on this also.
There are two types of category we have come up in Chandigarh. One is the paid facility, other reason is the free facility. As you know, paid facility, when somebody is staying, so he will have whatever he wants to have. So all the part of the hotels in which the doctors are staying, a section of that has been converted into these quarantine centers. So they are the fully air conditioned hotel again, and nice washroom, nice living room, nice TV, and everything is there. So there is no problem as such. And for the free facility, a few schools or sarai are the local inns, we call them, have been converted into these. They are also very well to do. Schools are very spacious, so not an issue. Suitable cooling facility, water, sanitation, etc. has been taken care of. Food in most of the places is supplied by the CITCO, which is the government run organization in which supplies the food to all the 5 stars. So more or less similar quantity and quality of food is given to the patient, or not the patient, but otherwise quarantined people. So mostly they are very happy and satisfactory with the food qualities and otherwise the sanitation and the basic healthcare we are giving.
Okay. Now we'll move to another important component, that is testing. If we are testing patients properly, it is one of the crucial elements that can help us fight COVID, and we have seen that across the world. So how these, if you can brief us on the testing facilities, and also we have seen plasma therapy is now being implemented in various states also. So if you can brief us on these two elements.
I'll try to go. We have a WHO representative with us in Chandigarh, who is a nodal officer for not only Chandigarh, Haryana, Punjab, and nearby states also. So in the today early morning, we had this meeting for COVID for the Papudam. We are opening one of the centers. So he discussed about this testing. I'll be repeating what he has said. He has told that the testing in Chandigarh is specifically as per the ICMR guidelines. ICMR guidelines are being followed. Are repeated by the Ministry of Health and Family Welfare. So all the targeted high-risk patients are being tested here. All the pregnant ladies, when they're going for delivery, are tested here. High-risk patient, suppose one of the family person is positive, so all the near contact, the high-risk contacts are being tested. So these are the basic premise for the persons we are going to test. And for testing, all the 3 hospitals, the Sector 16 hospital, Sector 32 hospital, and PGI are well equipped to test them. Besides that, we have contacted the IMTEC, National Association. They are also doing some tests. And recently, one private lab, SRL, in Sector 10 has been also roped in for doing the test. Yeah, the testing capability-wise, Chandigarh is doing well, and we are fine with the capability.
Okay. All right. You mentioned just about plasma therapy. You were saying something.
Plasma therapy, recently, early in the morning, we were, I think, watching some news, and that the WHO has questioned that kind of a thing. in Mumbai and Delhi they were testing. I don't want to comment that. I'm not in medical profession per se. So, but I think there were some reservations recently pointed out in the early morning news on this channel.
Okay. So at this moment, plasma therapy is not being done in Chandigarh, right?
I'm not aware if they are doing it, but mostly 99% they are not doing plasma. We are doing with the basic philosophy, but the ICMR has been telling us.
Okay. 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 Great. So if you can now, you know, you already said, however, that the educational activities and
One more thing,
yes,
before into the education, recently the administration has come up with these chalaning procedures in which people who are in Chandigarh, whether they are citizen of Chandigarh or otherwise, a resident of Chandigarh or a resident of other part of the country, if they are in Chandigarh, they have to maintain, monitor the self-distancing measures, the mask, the proper social distancing. If they are not doing so, they'll be challenged heftily. The minimum challan is 500 and maximum is 3,000, depending on the kind of the things you have found to do. And various officers, more than 100 officers have been across the Chandigarh have been empowered to challan you. So if you are watching this and if you are in Chandigarh, so I request you to follow all the norms. Yeah, now we'll shift to education.
yes. So you were mentioning about the educational activities, schools, colleges. These are right now not working, not open in the city, right? How soon you are planning to? Of course, we have to follow the central guidelines also for all these activities. But what are your views on this?
Chandigarh is a union territory in actual, so all
Yes.
the guidelines of the government of India are verbatim followed here. So
Yes.
far, the last night order, it's up to the 31st of July that we'll be having holiday session continuing in the schools, colleges. So we'll be following that. But beside that, one thing I would like to point out here that most of the schools, educational institute, college, I am looking after the technical education. We are doing that online classes and online courses.
Yes.
So students are being actively engaged in most of the institution, and I hope all the faculty and the students are related to each other and are in well contact, so that the time loss is not there.
So how well these online classes are going on?
I can talk it about for the technical education. Recently, we done a survey in which more than 200 calls were given to random students for different courses, and more or less 80% satisfaction survey was given back to us. So 80% is decent in the normal times में भी class में होता ही है.
Okay. Okay. One more important thing that I'd like to ask you, that now since again people are started moving from one place to another, and migrant laborers who had earlier probably moved out of Chandigarh, probably you might be seeing them returning to the city again, right? So what are the precautions now you are taking that any person, any migrant laborer who is coming to the city is not again exposed to the virus?
Okay, first of all, like there are three modes by whom people can reach Chandigarh. One is the air mode. So all the people who are traveling through the air are being contacted. We have a senior officer of the rank of DIG police is being looking after the air travel. So he gets get all the manifest of the patient or the passengers rather who are coming to Chandigarh, and we contact them and enforce the self-home quarantine if they are willing to stay for more than 72 hours. Similarly, for railway travel, another mode is railway. So whosoever is coming by railway, mostly we can assume that migrant labor would be coming by this train facility. So dedicatedly, suitable number of teams are being placed at the railway station by the district administration here. As soon as a train is supposed to come, one senior level officer, he is a forest service officer, goes there along with the medical team, and we screens most of the fellow who are dropping down from the Chandigarh. Daily basis, we are getting reports that so far no one has shown any symptoms.
And how about the monitoring?
Monitoring for?
For example, these people who are coming into the city, right?
Yeah.
We have to also ensure that if at all they are asked to be quarantined, and if at all they are asked to remain at home, right? So what are the
There are two types of quarantine now since you have delved into this. One is the otherwise quarantine. Suppose I was in Chandigarh and I got some infection. So I have to be quarantined, my family has to be quarantined. So for that we have a dedicated team. I was talking about the contact tracing team. So we have that 60-70 people who goes for the random checking, and they do the chaspa of that particular notice that this house is under quarantine and have been COVID positive. And for the people who are coming from outside the city, for them we are enforcing this COVID inbound visitor portal once they are staying back for more than 72 hours. So a local call from the call center, police call center, 112 say उनको call जाता है, they are receiving a call that you have to be, are you self quarantining yourself? And beside this, we have created another team under a senior officer. He is an HCS officer. He has another 30 odd fellow under his control. So they go randomly to their houses and check whether the person is doing so. Besides this, beat constable police is also being directed to go and check whether these fellow are maintaining the social distancing, whether they are residing inside their home. Besides this, we are also enrolled few of the Residents Welfare Association (RWAs) and the volunteers to foster this better into the system.
Okay. Now we'll move to the other department that you're holding another charge as additional registrar of cooperative society. So we would really like to understand the challenges that the crisis has thrown away on your perspective from this position, how this department is facing and witnessing the challenges.
I think somebody asked arts college, not the cooperative, but I will tell about the cooperative. Cooperative department, we have this cooperative acts we have. So cooperative society are being registered under this cooperative act.
Right.
So whenever suppose a group of people come and that we say we want to register ourselves as a cooperative society, then we register them as a cooperative society, then they fuse in some money as per their shares, and then they become the member of the society. And after that, members, they can buy a plot of land. Mostly residential cooperative societies are there in Chandigarh. Otherwise also, I'll give another example for residential complex, जिनकी ज़्यादा issue है, उनके बारे में बात करते हैं. So once they pool in the money, they buy some land either from the state office or from the housing board. Once they pay the money to the housing board, then they can pool in more money and then they can develop their society. They can have their flats or whatever they want to have, the bungalow or whatever. And this is the normal routine. But what happens over a period of time, there is an election. So a particular part of the society is being more empowered, then few of them feel neglected. Then the society in power do some things which the other fellows are not liking, and similarly there is a rift goes on between them. So over a period of time, what happens? There is a clashes, there is a mutual disharmony among the societies. Then the cooperative act, there is a provision under section 60 and 61 in which the dispute between the members, between any two members, the member and society the society and member, can be heard by the registrar cooperative society. So people put in their petition and we decide on the basis of the facts and the records that what is to be done and what cannot be done. As a registered cooperative society, our mandate is that the interest of the society in general, not only the management, the society interests should be protected.
Okay, great. There are some questions if you can see on your window, or if you want, I can read it out for you.
Karthik Sharma says, as the principal of Arts College, you have worked on giving recognition due to the place. Can you please share the initiative? Okay.
Yes.
Particularly, Government Arts College is very dear to me. It's kind of a stress buster among all the hustle bustle of the administration we do. It's a very nice college. If whenever it's opening, I'll request and invite everyone to at least visit this nice facility in the Chandigarh. It's mostly open. So first of all, we have created. Historically, this college has started much before the independence. It started from the Lahore early phase. So there was a college which was after independence was bifurcated in one part came to India, other part remained in Pakistan. So in India, it came to Simla for a few years. Then it was shifted to Chandigarh when Chandigarh was under the developing phase. So the building of Arts College per se is a heritage building, one of the building which has been designed by the La Corbusier, who has designed the Chandigarh in actual. So we are running 4 courses here: graphics, applied, and painting and sculpture. So recently, what initiative which we have taken is, first of all, to showcase such an important college is very important. So in virtual space, the presence was negligible. We have very old study kind of a website. So we developed very interactive kind of a website. So one of the initiative was to revamp the website. You can visit that. It's now very interactive and much more work has to be done on that also. Besides this, we have started the placement of the student. I am from engineering background. So for our engineering, placement is the zenith or the epitome of the entire course or the entire 4 years. But in arts college, most of the students were doing the freelancing work in which their potential was not reached. So I was just wondering why don't they do a formal placement. So we are now starting with the placement thing. We have appointed a training and placement officer who is interacting with the industries, and we'll be inviting few of the industries. Because of this corona, all these activities have gone a little setback and got a little setback. But we will be starting as soon as possible. Besides this, such an important college didn't have a alumni meet so far.
Okay.
We are a student who are based in London, based in Paris, and doing artwork, but somehow they were not ever contacted by the college. It's an unfortunate thing. So I got the opportunity, and we read on it. We invited more than 10 batches in one go, and most of the people came. More than 250 gathering we had in from the past. The senior most student who came was of the age of, I think, 78 years. He is living in Amritsar as of now. Yeah.
That's interesting.
And we have handholded these few of the students who have represented not Chandigarh but India at the international level. We have two students who have represented, who have bagged third position at the national level, and one of them have represented India at Russia in the skill competitions, world skill competitions.
Okay, great. So how your IIT experience came in handy when you had this college?
The Badmaash College definitely is a tool we had to counter the views of the students or otherwise also. Whenever they want to do, when they are not asking like the placement, they are not asking ever. But for engineering, this placement thing is very important. They are not asking for extracurricular things because they are mostly engaged in their artworks. So we have started special things in which the cultural activities are being done. Their sports events are more intense now. So these things we are doing. Recently, one more thing I would like to mention here, we have taken a consultancy work from the prison department of UT Chandigarh, in which almost 13 lakh rupees का project है वो, जिसमें we'll be developing this portrait of our freedom fighter Bhagat Singh, Gandhi ji, and Subhash Chandra Bose. Like that, we have developing 32 portrait which will be deployed in the prison. एक बुरेल जेल है यहाँ पर चंडीगढ़ में, उसमें the jailer, the superintendent is a close friend of mine. So he has this viewpoint that he wants to name these. He wants to replace the terminology like we have seen in movies that we call them barrack number 4, barrack number 6, barrack number 8. So he wants to say barrack number Bhagat Singh, barrack number Sayyid Azam, all these things he wants to say. So we are developing on those lines. The work was almost complete, but because of this COVID, we have a setback.
Right.
We'll be launching it by the 15th of August this year.
Interesting, sir. We again have one more interesting question from Mr. K.C. Mishra, Uttarakhand. He is asking, you're heading the technical education wing of Chandigarh administration. So you are naturally well placed to mitigate the migrant crisis. What were the challenges and what are your programs and initiatives to rehabilitate these migrants? And are you planning any short-term or mid-term vocational courses to enhance their employability?
We are not planning per se, but the course is always open. We run continuously during my tenure of last 2 years here in Chandigarh. We are continuously running this PMK, Pradhan Mantri Kaushal Vikas Yojana, which is a short-term course in which there are more than 32 vocations in which the people are getting trained, starting from the housekeeping jobs to the data entry operator, the computer hardwares and everything, solar panel we are making them. So if somebody wants to come and register themselves as an applicant, we don't have any issue. We'll welcome them with our open arms, and if they want to come and register themselves, they do the course of basic 4 months, short-term course it's only. And after that, there's a mandate of more than 70% placement we have to give for all the participants. So whosoever clears that course, out of them 70% has to be mandatorily placed by the institution or the us.
Okay. So before we move to one more question that is there on the screen, I'd like to ask you,
Yep.
we everything is going seems to be going good at this moment. We in Chandigarh, as far as Chandigarh is concerned, the number of patients is not so high. Active patients are we do not have many active patients and all. But still, what are the challenges that you are facing in your day-to-day activities due to this COVID 19? We have to stop it, right? We have the minimum cases, but then we do not want these cases to be again increasing. Uh, what are the measures now you are undertaking uh, in the city
Uh,
that
uh,
people, they do
as I
not
said,
they do not take it for granted and they just do not relax that everything is over.
when I say that number of active cases or the containment zone have been only 6, it does not mean that cases are not coming from other part of the city. We have in the early morning we were reported cases from sector 23 and let me recheck. Uh, Sector 29, 6 cases, Sector 23, 3 cases, Sector 47, 41, 7 cases.
Mhm.
These are the other cases, but these are sparingly dispersed cases, so not much of a concern for us because we can trace their history. Somebody has visited them from Delhi or Mumbai, or they have gone outside to Amritsar for some ritual. So we have that kind of a thing to pinpoint that from where the infection might have come. It is not spread from within the Chandigarh to that person. So these things are there, but again to control these things and to come up with better situation, only people can help themselves. If
Right,
they are willing to come out and take the risk, then they can take the risk. But it's very severe when you go for that treatment. It's very severe that when you see a doctor totally covered in that PPE kit and he's not able to speak to you because of his triple layer mask. The doctor nowadays are wearing double mask, so they cannot hear you. You cannot speak to them. Then what kind of a situation you are? It's very difficult to converse, and you will be in a very depressive kind of a situation because nobody can help you because family will not be able to visit, family friends will not be visiting you. They are not you should not them want to visit you. You will be more or less isolated yourself, so it's not a very enriching or a good experience to be. So better would be to stay at home and to take precautions and save yourself and save your near and dear ones.
right. One question I forgot to ask you about the testing facilities. Do we also have arrangements where patients can have this test at their home in the city?
Such kind of a facility, so we have not developed that patient can take their test at home. Whosoever wants to take, undergo a testing in the government facility, they have to go to the hospital and report for the symptoms. When there are symptoms, they have to the medical doctors take their samples and they are being stayed there till the time report is there. If their report is positive, then they are further treated, and if the report is negative, then they are allowed to go back to their homes. This is the protocol. In
Right.
the private lab, people are driving in their cars and they are going to the lab, and then sample is being taken, and then they are going back to their homes.
Someone has asked, how about the lesson learned during this COVID 19?
Uh, lesson learned are many. We have come up with it was very depressive kind of a situation, very exciting situation, very troublesome time. We have seen very another thing from the Red Cross, dead body management. The first case which I encountered in which the local person died, the family was not ready to come up for
Yeah,
the commission. The volunteers has to do it. These are the very troublesome time, and people were not willing to take the risk for their dear ones also.
right,
So the lessons learned are huge, and I hope these lessons learned are not never used in our life. We'll
right,
finish these lessons here only, and such a contamination in future should not be repeated entire in the country or the world also.
great. What is your message
Sir, I think there is some issue with the Marcel's link.
Aji.
I'm just checking, sir. Please wait for a while.
Yeah, hello. Am I audible?
Yes, audible, not visible.
Yeah, I'm sorry. I'm sorry. The connection was lost, sir. So, I was just asking you what would be your message to the people of Chandigarh.
Not only people of Chandigarh, but to the entire country. We have to take care of ourselves. We have to take care of elder ones, the dear ones, the smaller ones, and we have to take all the precautions, whatever possible we can have to kind of save ourselves and save our near dear ones from this deadly virus. Yeah.
All right. So, thank you, sir. That's all from my side. If you like to add anything, you're most welcome.
Thank you so much for having me. It's a nice initiative that Elets has come up. In any case, Chandigarh, you have any problem, so you have to contact the central helpline 1075 or our local helpline 112, in which you can report all the cases, all the participants.
All right. Thank you, sir. Thank you so much for this interesting interaction, and we wish you all the luck and all the best from Elets Technomedia Private Limited to Chandigarh Administration, and we will surely fight this virus and win against it. So, thank you so much for your time once again.
Thank you.